Clinical case vignette, interpretation of laboratory values for diabetes mellitus diagnosis. A 52-year-old man presents to the clinic for a routine checkup. He has a history of hypertension and obesity, BMI 32 km², but no prior diagnosis of diabetes. He reports increased thirst and frequent urination over the past few months, but attributed it to drinking more fluids. On physical examination, BP 135/85 mm, HR 78 BPM, BMI 32 kg/square, no acanthosis nigricans or signs of neuropathy. Laboratory results: fasting plasma glucose, FPG, 130 mg normal, 100 mg diabetes to 126 mg delete. Hemoglobin A1C, HbA1c, 7.2%, normal 5.7%, diabetes 6.5%. 2-hour oral glucose tolerance test, OG, 210 mg normal, 140 mg diabetes 200 mg per. Random plasma glucose, 220 mg per diabetes 200 mg with symptoms. Based on these findings, the patient is diagnosed with type 2 diabetes mellitus T2D. Question 1. Which of the following laboratory values confirms the diagnosis of diabetes mellitus? A. Fasting plasma glucose of 110 mg per deciliter on one occasion. B. Hemoglobin A1c of 6.2 per C. Random plasma glucose of 220 mg per deciliter with polyuria and polydipsia. D. 2-hour OGTT of 180 mg per deciliter. C. Rationale: diabetes is diagnosed if any of the following confirmatory criteria are met. FPG to 126 mg, A1C 6.5, 2-hour OGTT to 200 mg, random plasma glucose 200 mg with symptoms. Answer choice C meets the diagnostic criteria. Question 2. Which of the following is the most appropriate next step after diagnosing diabetes in this patient? A. Start metformin and lifestyle modifications. B. Repeat blood glucose testing in 3 months before starting treatment. C. Initiate insulin therapy immediately. D. Order an MRI of the pancreas. Answer. Rationale: first-line treatment for newly diagnosed type 2 diabetes includes lifestyle modifications, diet, exercise, weight loss, and metformin. Insulin C is reserved for severe cases with symptomatic hyperglycemia. Repeating the test B is unnecessary if diagnostic criteria are met. Question 3. Which additional test would help differentiate type 1 from type 2 diabetes in this patient? A. C-peptide level. B. Liver function tests. C. Thyroid function tests. D. Triglyceride levels. Answer. Rationale: C-peptide is a marker of endogenous insulin production. Low C-peptide suggests type 1 diabetes autoimmune destruction of beta cells, while normal or high C-peptide is more consistent with type 2 diabetes. Question 4. Which of the following is the most effective lifestyle change for improving glycemic control in type 2 diabetes? A. Reducing salt intake. B. Increasing protein intake. C. Weight loss through diet and exercise. D. Taking vitamin supplements. Answer. Rationale: weight loss, 5 to 10% of body weight through diet and exercise, is the most effective lifestyle change for improving insulin sensitivity and glycemic control in type 2 diabetes. Would you like additional variations or modifications?